how do you envision the future of pain management evolving to better meet the needs of the patients? I'd like to include healthcare professionals in that if I can as well.
So I think some of the advances in technology are great. I do think AI that allows us to be more present in a conversation and an interaction with a person can be something very helpful. Again, I just fear sometimes of us getting less human by getting too enamored with technology. And you're talking to somebody who, my wife has declared me a technology junkie, so I'm all for it. But I think, again, we have to put it in perspective to make sure we don't lose the humanity of what we're doing. And I think that, to me, those are the advances I think we can make, is how do we better understand how the mind body influences each other, because too often in healthcare we've put those two in two separate buckets. You're going to talk to somebody about what's going on in your head and somebody who's going to go on talk to you about what's going on in your body. They're one and the same. You can't cordon those two off, because what goes on in your head influences your biology. When that head is in a haunted house, it trucks out a lot of distress, stress, and different things. So I think we need to have a future of pain care that helps patients better have information to connect their unique story to their unique biology and how their body's expressing pain, and then have some medical advances that can help support that as well. I'm not saying, again, medicine doesn't have its place. It's just often patients are so stuck in the, I need to find the next tissue or medication or next procedure that's going to fix it. And nobody's helping them understand their life around their pain that's probably driving the situation more than their x-ray or their MRI or whatever tissue-based variable that, and again, they can have importance. I'm not saying we strip tissues out of the equation, but when people have been chasing tissue-based fixes for sometimes decades and life still isn't getting better for them, I think we need to take pause both as patients and as clinicians. Like, we need to do something different. And I think that difference is helping connect them to their story and how they can rewrite their story and take control of that driver's wheel to start charting a different path with it. And it doesn't have to just be a healthcare system that isn't listening, that's failing in more and more procedures to fix their pain, where they can start getting the wheel and starting to fix themselves, I guess you would say.